Today I'll be diving into an important topic that affects so many new moms out there, and it is none other than postpartum depression. If you're a new mom or you know someone who just had a baby, it is important for them to know about this disease, to be able to know how it manifests so that they can get the help that they need. In this video, I'll be sharing with you 9 commonest symptoms of postpartum depression, and I'll also share some actionable tips that you need to take if you are experiencing these symptoms. Hi there, I am Dr. Nindi Shalom, and this is Health Corner. Here I share with you guys daily health tips, and I bring you all the health information that you never thought you needed so that on a daily basis you can make better health choices. Please subscribe to my channel, follow me on all my social media platforms so you don't miss out on any updates. Let's get started. Before we dive into some of the symptoms of postpartum depression, it is important for us to distinguish postpartum depression from baby blues, or what we call postpartum blues. Baby blues is characterized by mood swings, deep feelings of sadness, irritability after you give birth to your baby. It occurs in up to 80% of women, and the main thing is that it lasts for a short period of time. It can start as early as 2 to 3 days after birth, but it usually resolves within 2 weeks. Meanwhile, postpartum depression can be more severe. It can start as early as 72 hours after delivery, and it can persist for weeks, if not months. Postpartum depression not only can be very life-threatening, but in most cases it requires medical or professional attention. I must emphasize that postpartum depression is not the fault of the woman. It is not because she is weak, it is not because she is soft, it is not because she is sick. No, it is actually a very serious health issue that needs to be taken very, very seriously. So what are some of the symptoms of postpartum depression, or what does postpartum depression actually feel like? Number 1, persistent sadness or crying. You just had a baby, you're supposed to be happy, but you realize that there is this deep feeling of sadness that doesn't go away no matter how hard you try. You try to smile when people are around, but deep down you feel sad. This is one of the major signs of postpartum depression. Number 2, extreme fatigue. I'm not talking about the usual tiredness. I'm talking about exhaustion. You don't have the energy to do anything. You don't have the motivation to do anything. You're constantly tired. You feel like you want to sleep for no apparent reason, even when you just slept. This could be a sign of postpartum depression. Number 3, sudden loss of interest in the things you used to love, the activities that usually made you happy. All of a sudden, you don't like them anymore. You don't feel like doing it. This could be a sign of postpartum depression. Number 4, deep feelings of worthlessness or guilt. You're a new mom and you're trying your best, but every time you feel like you're not good enough, you're not doing enough as a parent, you constantly feel guilty. Don't get me wrong, mom guilt is normal, but when it persists and it's getting to your head and it's getting out of the normal, this could be a sign of postpartum depression. Number 5, difficulty bonding with your baby. So you're always around your baby, but you feel like you haven't created that bond yet with your baby for no reason. The baby is fine, the baby is happy, but you just feel like you're not bonding. This could be a sign. Number 6, changes in your appetite. Maybe you're overeating, or you're undereating, or the things you used to like, you don't like them anymore, and you're starting to feel like this is not the normal you. this could be a sign. Number 7, you have difficulty sleeping. It is so hard for you to sleep, especially when the baby is sleeping. They say when the baby sleeps, get some sleep. But you're not able to get sleep when the baby is sleeping. When the baby is not sleeping too, you're unable to get sleep. When people are helping you out with the baby, you're unable to get sleep. This could be a sign. Number 8, thoughts of self-harm or harming your baby. So for no apparent reason, you just feel like you want to harm yourself, maybe because you feel you're not a good enough parent, or the baby doesn't deserve you, or you just want to harm your baby because whatever is going on in your head. Please get medical attention fast. This is one of the most extreme symptoms of postpartum depression, but it happens more often than you know. So if you feel this way, please get medical help. Number 9, chronic headache or body pain, general body discomfort, and sometimes stomach ache. If you're experiencing any of these symptoms, or you feel like postpartum depression is happening to you, here are a few things you can do. Number 1, get help. This is an actual medical condition, and we have different treatment options available for you. Don't sit back and try to deal with this yourself. Talk to someone, talk to a medical doctor, go in for a consult so that it can be addressed on time before you harm yourself or you harm your baby. Number 2, get some rest. This is important. I need you to focus on yourself and focus on your baby. The times that you feel like you need to sleep, get some sleep. Accept help from the people who are around you, who offer to look after the baby. As long as it's safe, try as much as possible to get some rest. Thirdly, be kind to yourself. You're doing all right. You're a great mom. The baby is just a baby. They are so happy that they have you as their mom. So be kind to yourself. Don't judge yourself too much. Whenever you get those negative thoughts that tell you, oh, hey, you're a bad parent, you're a bad mom, you're a bad dad, be kind to yourself. You're doing amazing. Number 4, do skin-to-skin contact. So you can wrap your baby. There are different techniques for skin to skin. You can look that up. But this really helps you if you feel like you're not bonding enough with your baby. Just do skin to skin for about 2-3 hours every day. It really goes a long way to help you get rid of some of those feelings that you have. Number 5, take your supplements. Some supplements have been shown to be beneficial in women who have these symptoms, like omega-3 fatty acids or fish oil, vitamin B3, or vitamin D. If you have access to some of these, go ahead, buy them and start taking them. Number 6, movement. Go out for a walk, even if it's just 10 to 20 minutes every day. Go out there and get some fresh air. Let the sunlight hit you. This really goes a long way to improve your mood and to clear your head of some of those feelings that you may be experiencing. And finally, number 7, this one is for family and friends. Be supportive. What you can do to help your spouse or your friend in this situation is to help them. If they need help with the baby, provide assistance. If they feel like the house is not tidy, help them to tidy up. If they feel, uncomfortable, just be there as a form of support rather than throwing derogatory comments. Oh, you're fat, you gave birth, you're so lazy. After you gave birth, you're this, you're that. It doesn't help. As a spouse, as a friend, be supportive. Be there for them as much as you can and do not judge, okay? I want you to remember that postpartum depression is a very serious health condition that affects so many women out there. So you are not alone. And if you are experiencing these symptoms, please reach out for help. We have so many treatment options that can help you feel better. Thank you so much for tuning in today. If you found this video helpful, please share it to someone that may need to see it. Don't forget to like, follow, and subscribe to our channel so you don't miss out on any updates that come from us. Thank you so much, and I'll see you in our next episode. Bye-bye.